Today I'll talk about hypothyroidism in babies. Why does hypothyroidism happen in children or newborns? We are all aware that women, especially young girls and middle-aged women, there is a higher chance of hypothyroidism in them. But can a newborn get hypothyroidism? Yes. Newborns can get hypothyroidism if they are born without a thyroid gland. So all of us have a thyroid gland with two lobes, right lobe, left lobe and an isthmus. In some cases with a standard frequency, this occurs actually where a child is born without developed thyroid gland. So in such instances, the child has no thyroid tissue at all and the TSH is very high at birth actually. And this is picked up by something called a screening procedure. A screening refers to detecting a disease before the signs and symptoms develop. And what is the advantage of screening? The advantage of screening is that you avoid the damage that is caused due to the disease. Typically, when there is a baby with congenital hypothyroidism and it is in the uterus, the baby gets the thyroid hormone from the mother because the mother has normal thyroid function. So the thyroid hormone from the mother will go to the baby and the baby will be developing normally. But as soon as birth occurs, the umbilical cord is clamped, the baby is on its own and the thyroid gland is no longer with the baby because the baby does not have a thyroid gland. There are some instances where there can be thyroid dysharmonogenesis also, where the thyroid hormone is not produced adequately from the thyroid gland. There are enzyme deficiencies within the thyroid gland itself that causes this one. In such instances, we should pick up the disease early by screening and start treatment early, preferably within 15 days of birth. This is in order to avoid any neurological development. So what happens when we are not instituting a screening process? So all over India, wherever you go, almost all places now have newborn screening for thyroid. So as a parent of a newborn, you should make sure that you collect the TSH report in time and you see the TSH report and discuss it with your pediatrician and take appropriate action to prevent damage due to congenital hypothyroidism for your baby. That is number one. Number two, if screening has not occurred for hypothyroidism, then the child can develop signs and symptoms of hypothyroidism. What are they? A hoarse cry can be there. The baby will not grow. The skin will become unhealthy and the baby can develop mental subnormality. The baby's mental development will not occur and physical growth also will not occur. So, but these are catastrophic results for an infant and they may not be fully reversed if the treatment is started, say, after 2 months or 3 months of birth actually. So, it is very important and key that we screen newborns for congenital hypothyroidism and we treat for congenital hypothyroidism using thyroid hormone. Typically, larger doses of thyroid hormone are required because the baby does not have any thyroid gland. So, larger doses are required for a newborn. And also babies cannot be fed on empty stomach like adults actually. So the absorption may also be poor. So they will take the thyroid tablet and immediately drink breast milk. So it may be a higher dose will be required usually for newborns and infants basically. And this is a very important aspect of thyroid care where you must consult a good endocrinologist who will take care of the baby's thyroid function. So in order to protect the future, intellectual function of your baby.